So today, our guest in our podcast is Dr. Vamsi.
Thank you very much, sir.
You telling me certain interesting stories, which was heartbreaking at the same time. It was like a heroic story for me.
During my PG preparation days, due to some financial constraints, I couldn't afford to buy proper PG entrance examination books. A little bit depressing.
How was your experience working with us?
Santosham Chest Hospital is a different setup, sir. So two generations can be seen at a single point of time.
Dr. Vamsi has started doing minimally invasive, that is keyhole heart surgery.
Whoever patient is eligible for sternotomy, that patient will invariably be eligible for TCRAT surgery. So that is the reason I wanted to go to Dr. Alexander Babliak even during the war.
What is ERAS protocol and where you got that interest from? What do you...
I heard the word ERAS from you, sir.
Are you taking any steps to stay fit and healthy?
I spend a lot of time walking.
Memorable or dramatic cases that you have done?
So I mean to say that the patient heart was very weak. Like it was 23, less than half. It is a failing heart. And we operated on that patient. Patient came out very well. And you will be surprised, sir. Patient was discharged on third post-operative.
Patient is not a case. Patient is a person. Coffee before surgery, yes or no?
I don't have coffee or tea.
Early morning surgery or late night cases?
Early morning.
If you weren't a surgeon, what would you have been?
I never thought of it.
The mentor who changed your life.
Rajiv Santosham.
Okay, that's... So today, our guest in our podcast is Dr. Vamsi. He's a cardiothoracic surgeon, and how I know him is because he was posted under us for thoracic surgical training for 4 months during his post-graduation in cardiothoracic surgery. So I know him for since 2019. But since 2012, we always had postgraduates posted under us every 3 to 4 months, sometimes even 2 people. But there's something special about Dr. Vamsi, and that is the reason I've invited him here. He has come all the way from Hyderabad to do this podcast. He is definitely going to be an inspiration to all the youngsters and even to senior people. And let's start this podcast. Welcome, Dr. Vamsi.
Thank you very much, sir. Sir, actually, this is an honor for me to sit in front of you for your podcast. I feel blessed to sit in front of you, sir.
So, Vamsi, so let's start by asking you a question. I always ask this question to all my guests. Tell me about your childhood, where you were born, where did you study, how was your childhood? Tell me a few things about your childhood which I don't know about.
Sir, actually, I was born in Karimnagar. So it was a part of Telangana state only. So then my schooling was in Hyderabad and Telangana districts. And my MBBS was at Kamineni Institute of Medical Sciences. So I joined MBBS in the year 2006. So I finished my MBBS in 2012. My MBBS was at Kamineni Institute of Medical Sciences. Then I joined DNB cardiothoracic surgery. So during my MBBS days, I was inclined towards USMLEs, United States Medical Licensing Examination. And during my internship also, I took a break and I had to travel to US to do my clerkships. And by then I finished my USMLE steps also. And after going to US, I found out 2 things. One is I was inclined towards surgery, not medical branches. So surgical fields are difficult to get in USMLE, relatively difficult. So due to financial constraints also, I couldn't continue further waiting for surgical branches, even though my scores are good. So I decided to come back, so pursue my surgical branches here in India. Then the very next exam I wrote here was at that time there was no NEET. There was a DNB set and this All India PG. And
so basically, there's no NEET.
No NEET.
There are only entrance exams for All India.
For all India and national institutes and DNB set separately. So when I cracked the DNB set, I got into cardiothoracic surgery DNB program. That is 6 years program. I joined Care Hospitals, Banjara Hills, sir. So that is in Hyderabad.
So I'd like to know a few things. Is there anything interesting about your childhood which you remember that you'd like to talk about? Your schooling, how your schooling was, whether you were always an intelligent child or you had to work very extra hard or, that kind of stuff. Tell me something about your childhood to get your background.
Sir, usually I used to be a topper in every class. From my childhood, I used to be a topper. Uh, so till eighth class, I was like studying in districts only, small schools, and from ninth and 10th, I came to Hyderabad. So I was fortunate enough to study in a good school, Vignan Vidyalayam. So that is in Nizampet, Hyderabad. So there also I was a topper, and then my intermediate, so 10 plus 2. So plus 2 was in Guntur Vikas, and I couldn't crack this MBBS entrance first time. So I had to do a repeat long term 1 year. That was in Hyderabad. Then I cracked.
Yeah, so I remember you telling me certain interesting stories, which was heartbreaking. At the same time, it was like a heroic story for me. I remember you because of those kind of stories that you have told me during our time in 2019. You used to tell me all these interesting stories in your MBBS days, which was heartbreaking, but it is like you came out like a hero in that. So I know, I think you know what I'm talking about.
During my PG preparation days, I like due to some financial constraints, I couldn't afford to buy proper PG entrance examination books, and also I couldn't afford to go to a good coaching center for PG and medical entrance examination. So that was a little bit depressing, but at the time, nothing was there in my mind. I should crack the entrance by any means. So I started borrowing some notes from people who already cracked it, my friends and all. So I started preparing my own notes, and after cracking the examination, I compiled all the information that I gathered, all the notes I compiled. I made it into a books, and I published it, and it is a PG medical entrance capsule. Uh, it was by Paras Publications.
Okay. Is it still available? Now it's obsolete because of NEET exam.
It is still available, sir, but I didn't update it. Second edition has not come. So first edition, it was a success actually. Like 2,000 copies were sold when I released it.
Okay.
So it
Okay.
was a good book. But after COVID, the things have changed. People shifted towards online materials. So I never had time to update it also.
I remember you telling me also you were called to the same college where you studied. I think during your PG days or sometime or some
Yes, yes, sir.
for doing some.
After joining my DNB cardiothoracic surgery, looking at my book, my principal, Dr. Shruti Mohanty, she was a biochemistry professor also. So she saw my book online. She remembered me. She called me like, "Why don't you come to the college as a guest lecturer? You come and teach students how to crack NEET in the first attempt." So at that time, I was like, I cracked NEET, I cracked DNB set only 1 year, one year. So yeah, I was in first year of my DNB CT surgery. So I was like surprised. How can be a guest lecturer, and how can I come to a medical college? And when I went there, it was like a honor, sir. I was like a guest lecturer.
You're just a student last year. Now you have become a guest lecturer.
Guest lecturer. I went there, and people were looking at me with a lot of respect, treating me with a lot of respect. It was a very strange experience for me. So Shruti Mohanty, Dr. Shruti Mohanty was also very kind to me. She treated me well. I had that opportunity to talk to students. So that was my first interaction with students as a part of my teaching career. After that, I joined Bhatia Coaching Center as a part-time lecturer, and I used to give lectures about many subjects of NEET PG entrance. Whatever topics are there in my book, I used to go and lecture radiology, surgery, medicine, pulmonology, whatever. So I used to be a part-time lecturer in a Bhatia Medical
While you were
Institute
studying
while
itself.
I was studying. So uh, usually our course morning 9 o'clock we used to go to the hospital, sir. 8 o'clock, 8 o'clock, and surgeries would be finished by 5 o'clock, 5:30 in the evening. So at 6:30 I used to go to Bhatia Institute. 6:30. Then the recording session will start at 7 o'clock. It will start from 7 o'clock till 10:30 or something like that. I used to do that recording sessions. So this used to happen 3 times in a week. So I used to go there, do my recording session, and they used to pay me like 2,000 rupees per hour. So I used to get 6,000 rupees for that one session.
Oh, one session.
One session,
Okay.
6,000 rupees for one session. So that used to be my part-time income, sir. And I need to tell you one more thing, sir. Like during PG preparation, there was one professor. I think he is now working in Madras Medical College. Dr. Manorajan, he is a nephrologist. Like he used to take classes on Harrison first edition and second edition, both combined, like concise lectures. He used to take for 15 days. So he used to take those lectures in Egmore.
Oh,
I don't exactly remember the address, but it was in Egmore.
this is during a PG preparation
PG
after
preparation,
MBBS.
after MBBS,
Before
PG
PG.
preparation. So I mailed him, sir. This is my rank in previous entrance. So I am preparing for PG. Is there any discount? And on top of that, I am also a gold medalist in MBBS. Can you give me some discount? So he told some nominal fee he told me to pay, like 1,000 rupees or 1,500 rupees. I don't remember exactly, but I paid that nominal amount. I came from Hyderabad to Chennai. I stayed in Egmore Boys Hostel. That was near to Santosham Chest Hospital. So daily I used to walk from the Santosham Chest Hospital to his coaching center. And morning and evening I used to eat in the Amma canteen. So 15 days I spent like that. So all these things I did because I couldn't afford a PG entrance coaching at that time. So Santosham Chest Hospital was in my mind during my PG days. But I don't
PG
have
preparation days.
preparation days. During my PG preparation days, I never had details about thoracic surgery or cardiac surgery at that time. But Santosham Chest Hospital was there in my mind. And the strange thing is, sir, during my PG, when I am pursuing my cardiothoracic surgery, I came to the same institute for 4 months. And when I came there, I remembered all these things. Like this used to be the road I used to walk daily and pursue my coaching and Amma canteen and everything. So those are the things I shared with you. And I was very fortunate enough to work with you people, sir. And good thing is that we were able to publish 2 international papers in those
when you were there.
4 months. Yes, sir. And
That's actually very commendable. Actually, before AI and everything, he had to do everything by himself. In 2 papers in 4 months is pretty.
Asian Annals, we
International
published 2
journals.
papers. Yes, sir.
And during that time, I think I just started doing uniport, single port VATs.
Yes, sir.
Just started doing single port VATs or uniportal VATs. And you were during the, I think Ptolemy was there just before that. And then you came and we started doing the
Uniportal.
uniportal VATs. This starting stage of
Yes, sir.
single port. That was a great time. I still remember certain surgeries we did. I made you do a fluoroscopy.
Yes, sir.
So I still remember that we did certain surgeries there, and I made you do certain cases which at that point I was not confident enough at that point to make other PGs do. With you, I had that extra confidence. Now I make all the PGs do certain things. I'm in a different stage right now. I'm able to let them open, even for VATs and everything. But that is a starting stage for me for certain things, which for you, which we did together and started. So that was a very interesting period. So, like Santosham Chest Hospital, that's our family-run hospital. So, how was your experience working with me, my father, and the whole institution, which is an old institution? It's been there for long, since 1937 or something. But it is like a family-run, homely kind of a hospital, and we are still doing advanced things. How was your experience working with us? I thoroughly enjoyed myself because you were extremely hardworking, never say cannot, and there's a pleasure seeing you and working with you at that point. How was your experience working with us?
Santosham Chest Hospital is a different setup, sir. Like we can't see that setup in the whole world. That kind of setup will not be there. One thing is Rajan Santosham is a fatherly figure of Indian thoracic surgery. When the thoracic surgery was in infancy stage, like Rajan Santosham sir was dedicated towards thoracic surgery when world is looking towards cardiac side. Cardiac surgery was a fascinating thing at that time, but Santosham sir started the legacy of initial stages of thoracic surgery at that time, and he was a pioneer. And maybe he has done maximum number of trachea surgeries in the world till date now, and all the procedures, like all the routine procedures, he was able to do. Like he is a fatherly figure. And next is you, sir. Like you were able to do all the recent advances in thoracic surgery. Never a combination will be seen in any institute. So if we come to thoracic surgery, like we will be able to see like how thoracic surgery has evolved. So two generations can be seen at a single point of time.
See, but I'll just add on to this. See, even till today, even though I operate nowadays, my father, Dr. Rajiv Santosham, is always there, sitting there. And decision making is always obviously better for a experienced person. And if there is something to be worried about, he will tell me, be a little careful here. So these kind of advices I get from him even till date, even though I'm more senior now. But that kind of experience, rich experience. He's a thoracic surgeon probably since 1978. So that's my age. From that's the year I was born. 47 years of experience he has imparted on me also. So you're right. I never thought of it like that. A hospital having the old and the new and. So I knew you till that point, till the point where you worked with us.
2019.
2019, just before COVID. After that, you had left. You had done. You have come up in life. I can see that you have done so many things. You have achieved probably. I would have spoken to you on the phone maybe 3 or 4 times. Maybe seen you in a conference 1 or 2 times. That's about it. So, what happened to Dr. Vamsi after his post graduation, after leaving Santosham Chest?
Sir, I finished my DNB cardiothoracic surgery in 2020. So after finishing my DNB course, I immediately went and joined KIMS, Krishna Institute of Medical Sciences, Rajahmundry. So it is a city in coastal part of Andhra Pradesh. So the peculiar feature of this particular center is they operate 100 cases per month, sir. Like daily, it will be around 4 cases on an average per day, and 100 cases per month, and a lot of variety and lot of hands-on. And the surgeon whom I worked under, Dr. Satish, is a very kind, very humble person, and he used to have a lot of trust on me. Like I used to work hard, I used to stay there in the hospital 24/7, and he used to put a lot of trust on me, and he used to give me a lot of hands-on also.
So hands-on, what he means is surgically. When somebody says hands-on, is they allow him to operate under guidance initially, and once they are confident, they let him do the surgery safely.
So I worked under him for 3 years. So after 3 years, I came to Pulse Hospital, Miapur, Hyderabad. So there I have been working since 2.5 years, and in between I went for a couple of fellowships, sir. So one is in Innsbruck, Austria, and another is in Ukraine. Both of them are, one is a minimal invasive valve surgery fellowship, and other is a minimal invasive coronary surgery fellowship. So Ukraine fellowship was a recent one. Like this year, February, I went to Ukraine.
So like I do VATS. People, you guys know I do VATS, uniportal VATS, where you do single port video assisted thoracoscopic surgery. Dr. Vamsi has started doing minimally invasive, that is keyhole heart surgery. He's doing keyhole heart surgery for valve as well as for coronary artery disease. That is CABG.
The reason I went to Ukraine is there is a surgeon, Dr. Alexander Babliak. He specializes in a technique called as TCRAT, TCRAT. So that is total coronary revascularization by anterior thoracotomy. Usually, minimal invasive CABG will be done by anterior lateral thoracotomy. Here, the incision will be there, sir. Now, he does by giving the incision on the anterior aspect, and the difference in this approach and this approach is all the cases where the routine CABG by sternotomy can be done, more or less the same cases they can be subjected to this method. So there is no selection. So we need not select the patient. Whoever patient is eligible for sternotomy, that patient will invariably be eligible for TCRAT surgery. So that thing impressed me a lot. So that is the reason I wanted to go to Dr. Alexander Babliak even during the war.
But weren't you scared to go? You're married with a kid. I would have been really scared to go to a place where there is
So
war.
Dr. Alexander Babliak, even today, he operates 2 cases per day. TCRAT, morning one surgery, evening one surgery. In such a war-struck area, they are doing these advanced procedures in cardiac surgery. Why not we do in a peaceful country like ours? Okay, that is what inspired me. So I wanted to subject all my patients to some minimal invasive surgery. Earlier we used to speak, sir. When I was in Santosham Chest Hospital, we used to speak about ERAS protocols, and we used to speak about how surgery should be done. Like there should not be much of anatomic and physiological
Physiological changes.
so there should not be
Homeostasis.
anatomical changes, major. There should not be major physiological changes. So these two things inspired me. So even thoracic surgery, even for open surgery or minimal access surgery, you will be going through the rib spaces only. Sir. But in cardiac surgery, we have to cut the sternum. So that is a major anatomic disturbance. So I want my patients to not have sternotomy. So anatomic disturbance should not be there. That is the thing.
So you said ERAS protocol. Why don't you explain to them what is ERAS protocol and where you got their interest from? And what you
I heard the word ERAS from you, sir. ERAS protocol, enhanced recovery after surgery. Like we used to talk a lot about ERAS.
I used to be
protocol.
obsessed
Yes, sir,
about
yes.
it and still am
Yes.
obsessed about it.
Like I used to watch you making the patient move on the few hours after surgery. Like maybe you reduce the time to 2 hours, maybe. Like I saw your recent videos. Earlier, when I used to be there, the maybe 6 to 7 hours after surgery, you used to feed the patient. You used to make the patient walk also. Dr. Satya is a wonderful anesthetist. He used to do early extubation on table, and you used to check for any bleeding. There is no bleeding. Patient used to sit up. Patient used to move around, and after a couple of hours, patient used to start feeding also. So, so I then started reading about ERAS protocols. So ERAS protocols, when we try to explain ERAS protocols, everyone starts from the extubation time. Early extubation, early feeding, early ambulation. Actually, ERAS protocols will start before surgery. Before surgery, and even this thing is not important, sir. I will tell you there are 2 important components of ERAS surgery. One is the surgery per se. Surgery should be perfect. There should be very good surgical expertise. Then only ERAS protocols will work, sir. If I do a bad surgery, if I do a bad anastomosis, patients will land up into LV dysfunction. There are ST changes. There are lot of inotropes for the patient. I can't apply ERAS protocol for that patient. So the surgical expertise should be there. Then ERAS protocol should be added to that patient for maximum benefit.
That's a nice way of explaining ERAS protocol.
So recently, last 180 patients who were operated by me by sternotomy, not minimally invasive, by sternotomy, I sent a paper to say my Asian Annals also, sir. So my average discharge time was 3 days. So I was following ERAS protocols for cardiac surgery by sternotomy, and many of the people were discharged on third post-operative day.
It's really very. I'm so happy somebody followed ERA's protocol after seeing me, because that is like something that was always like, I was always, right? I was always passionate about it. It's like it starts from before the operation, how you treat them, how you make them exercise, how you feed them, how you get them ready, and what kind of anesthesia you give, what kind of surgery you give, what kind of post-operative
Pain
pain
management,
relief
yes, sir.
you give, how you motivate them psychologically. All of that matters. I'm so happy about that. Where can we find Dr. Vamsi to get minimally invasive heart surgery done, where any patient who is fit for midline sternotomy, that is midline opening and heart surgery, can also get a keyhole surgery without selecting them. All of them are fit for thing.
I work at Pulse Hospitals, Miapur,
It's in
Hyderabad.
Hyderabad. Pulse
Pulse
Hospital.
Hospital, Pulse Heart Super Speciality Hospital, Miapur. So it is a part of western part of Hyderabad. So I have been like working there since 2.5 years.
I realize that you love teaching, you love writing books. Do you have? Are you teaching anywhere right now?
Right now, no, sir. Right now, no. Since COVID time, I stopped teaching, but I will soon start teaching the students who are pursuing cardiothoracic surgery. I have that plan.
That's really nice. So, what are the other hobbies? I know you as a very, 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 very dedicated doctor, very dedicated surgeon, very dedicated cardiothoracic surgeon. No doubt in my mind. Do you have any other hobbies and interests apart from this? Or are you like my father who has this is the only interest?
Before my kid is born, this was my only interest, sir. But now I love spending time with my kids.
A lot of my subscribers and my viewers will be gym goers and fitness related people. So to them, I want to, because of them, so to them, so because of them, and also this is part of my life, I want to know what kind of things do you follow in life to keep yourself healthy and fit. You're 30 something, early 30s. You are definitely going to be fit, whatever you do. But are you taking any steps to stay fit and healthy, like watching what you eat, any kind of exercise, anything that you do? Why don't you share with our viewers?
Sir, right now, nothing, sir. Right now, to be honest, right now I do nothing to be like more fit or something like that. I spend a lot of time walking. That is what I do. But during the recent times, like it is only 4 years since I passed my DNB. I was completely focusing on my career and improving my skills and enhancing this ERAS protocols and all. But definitely, it is the time for me to also focus on my health also, sir. But till now, I was not focusing much on my fitness kind of things. But I walk a lot.
I think walking is one great thing, but I'm happy you came here and I've motivated you to start doing something for fitness. Talk about one or two memorable or dramatic cases that you have done recently or sometime back also.
The first case is we did it together, sir. It was a paraganglioma.
Okay.
Actually, it was in the middle mediastinal paraganglioma, which is a rare thing to see. The patient actually
Location is
location is rare. Patient came from Oman. She had 19 children. We we actually traced out all the family history. We did genetic study. We first approached the tumor from the side of the chest, but it was a very difficult part. So immediate decision was taken on table, and we were able to do sternotomy, like we cut open the breastbone, and then we could able to locate the tumor with great difficulty, and send it for histological histopathology. And this was a case I usually remember, sir. I actually this is one of our international publications also. That was a most memorable case. The patient recovered very well, and she traveled back to Oman within 3 days. and a lot of people were involved in the case. Dr. Shivagnana Sundaram sir, and pathologist, and many departments, and neurophysician was involved. So it was a difficult case actually. So I remember it. And second case was I personally I operated on that patient. That ejection fraction was 23.
Normal ejection fraction is
Ejection fraction is the pumping capacity of the heart in common man language. Usually, the ejection fraction, the normal ejection fraction is 55 to 65. So, I mean to say that the patient heart was very weak, like it was 23, less than half, less than half. It is a failing heart. So, we took up that case as a challenge and we operated on that patient. Patient came out very well, and you will be surprised, sir. Patient was discharged on third post-operative day.
so he could the heart chest pain and the breathlessness all
All
disappeared.
disappeared. Now he is doing good because it was a hibernating myocardium. Like it was a
Not a dead
not
myocardium.
a dead myocardium.
Not dead. The heart was not dead.
It was a resting phase, we can say, for a common man's understanding. It was a resting heart. So we were able to give it the blood supply it required, and he recovered very well. Now the ejection fraction has improved to 55% on the recent visit, and he is only on one combination drug, that is a blood thinner and statin, cholesterol medication.
It's very satisfying, these
Satisfying,
kind of
very
cases.
satisfying.
So, like we all know, cardiac surgery, heart surgery is a very stressful surgery. How do you manage stress before, during, and after? I think the common people have to know that our profession is a very stressful profession. How do you manage the stress?
Sir, first thing I will come from the beginning. Before going for the surgery, we speak to the patient and family members. Okay, so when they are in a calm position, when they are calm, we feel a little bit less stressful. Okay, any stress or fear comes from the unknown. When earlier in our school days or college days, our parents used to say, like, after getting our hall ticket, tomorrow is the examination. Today you go to the center, look around, have some acquaintance with the center, and come back. That gives you stress free, like on the day of the surgery. So the same thing with the patient relatives also and the patient. If you tell them everything, each and everything, what will happen during the surgery and after the surgery. During the surgery, before surgery, we will put all the lines, neck line and hand line, radial line, femoral line, etc. Everything will be put. You will be given anesthesia, and you will wake up with all those lines. You will wake up with pain, and everything has to be explained hourly. This will happen. We will extubate. We will remove the line. You will walk. You will climb stairs. Everything, if we explain to them, the fear of unknown, that will be eliminated. If they are stress free, half of our stress will be gone, sir. And the second thing, our team members should be well informed about the procedure what we are doing. I cannot keep something in my mind and start yelling at my assistant when something goes wrong. I should prepare her or him. These are the steps I will be performing today, so they will be able to assist me properly. Second thing. Third thing is that, unfortunately, if something goes wrong, because surgeon is the captain of the ship, he should not be panicked, or he should not shout or yell at others. If I observe this with me and myself, sir, if I start yelling, everything in the operation theater will be disturbed. So I realized it 2 or 3 times. I yelled due to stress. My intention was nothing should happen to the patient. That was only my intention, not with the intention of yelling at them or hurting them. So, but even keeping ourselves calm at that stressful moments, will change the entire OT scenario. Just close your eyes, think about it for 2 or 3 seconds, calm down, and then start doing the procedure. Everything will be under control. That is what I believe.
When you see a young doctor who's just finished his MBBS, getting prepared for his NEET or whatever, what is the advice you'd like to give that doctor? And what would you... So what is the advice you'd like to give that doctor for his future? Because being a doctor, not only is stressful, you have to get another seat And then on the street, then you have to update yourself. So many things are there. But what kind of advice would you like to give the younger generation of doctors? I know you're still not so old, but you are wise and you have achieved a lot. So I'd like you to give advice.
First, go with your interest. First advice that I would give is go with your interest. Don't forcibly push yourself into some branch which you don't like it. A first ranker, NEET PG first ranker, or maybe below 10 rank. If he is really interested in ophthalmology, take it. Not that previous year first ranker took radiology, I will take radiology. No, no, no. You should not do like that, because you are going to live with that branch for your whole life. So if you are interested in ophthalmology purely with your heart, take ophthalmology. No, no, that is not a bad branch. Every branch is good. So that is one advice I want to give. Go with your interest, first thing. And second thing, coming to the surgical branches. So you are a cardiothoracic surgeon, I am a cardiothoracic surgeon. Coming to the surgical branches, during our MCH or DNB training period, everyone's mindset will be like, I should do more number of cases. I should do a case first, I should operate, I should do more number of cases, I should operate on more number of patients. That will be our attitude, our mindset. And later on, while we are evolving, we will see some big surgeons, big named surgeons. So they will be doing some difficult surgeries, which no one else will be doing. So our attitude will be like, we should do those surgeries, difficult surgeries we should perform. So mindset will be changing from one point of time towards other. So mindset will be changing always. So my advice to young surgeons is, surgical hands-on. Everyone will get it, sir. One time or the other, everyone will be able to do those simple cases or difficult cases or whatever. One thing is, you should develop empathy towards the patient. You should understand the patient. Patient is not a subject. Patient is not a material. Patient is not a instrument or something like that. He is a person. He has a mind. He has a family. Show some empathy and develop that empathy from the beginning of your career.
This is such a beautiful advice you've given. I was expecting you're going to give some, some kind of. It's such a beautiful, wonderful advice that every doctor should know. Patient is not a case. Patient is a person. You're beautifully put. So we're done with the serious part of the podcast. Now let's go and do a rapid fire round. So favorite instrument in surgery.
Forceps.
Longest case you've ever done.
7 hours. It was CABG plus double wall replacement.
Coffee before surgery, yes or no?
I don't have coffee or tea till now in my life.
Favorite part of cardiac surgery.
The main surgical part, sir.
Heart or lung? What's tougher?
Heart.
Early morning surgery or late night cases?
Early morning.
If you weren't a surgeon, what would you have been?
I never thought of it.
One word your colleagues would use to describe you.
Hardworking.
The mentor who changed your life.
Rajiv Santosham, sir.
Okay, that's nice. One motto in surgery you live by.
We should always go by the quality of the surgery, sir. We should give the best in our surgery to the patient. Like, it is not like I did these many number of cases, n number of cases. That is not important. So quality is important.
That's really, really beautiful. Anyway, it was really nice having you, Vamsi. And I enjoyed this meeting. And even during I think the only time we spent so much time together was in 2019. So it was wonderful having you. Thanks for coming all the way from Hyderabad and spending this evening with us. I know you're a really, really busy person, and it's a Tuesday, middle of the week. Thank you.
Thank you very much, sir. It is actually an honor for me to be here. Very happy to see you again.
Thanks.